Okay, awesome. All
Happy
right.
Thursday, everyone. So we got a couple of folks with us, and I'm sure we will get more that watch on Zoom. This seems to be a popular topic. So, Juliana, I'll let you just dive right into things, tell us about yourself, and get going. And then I'm sure with our small group, we can ask questions too. I'm sure there'll be.
Yes, of course. Sounds great. So my name's Juliana. I'm here to talk to you guys tonight about tips to maintain a healthy pelvic floor. And I'm hoping to also dive into a little topics kind of relating to cycling, since that's why all y'all are here. And just some tips to help maintain good pelvic health throughout your lifespan, but also as you maintain continuing your sport. So let's dive into it. I'm going to start a little bit with my background. I'm Juliana. I'm a pelvic health physical therapist, and I founded Pacer Physical Therapy in Boston. I was working for a physical therapist as a physical therapist for over 5 years. I started in pediatrics, working mostly with kids. And then the more I started working with families, the more I spoke to moms, the more they were like, "Hey, my back hurts, my hip hurts. Can you help me?" And I was like, "Yeah, I can help you. I treat adults too." And then we were kind of going back to a lot of the symptoms they were having stemmed from post delivery. And so that made me dive more into, is there a gap that we're missing to help these moms after they've had these kids? So I started to pivot into more of pelvic health. So my practice is really based around anyone with a pelvic floor, female or male identified or other, and also surrounding folks who are pregnant or who are postpartum. And I consider anyone who've had a child to be a postpartum person because you've had changes that happen to your pelvic floor during pregnancy and delivery. So that's kind of what our bread and butter is there. In addition to being a pelvic floor PT, I'm also a post collegiate track and field athlete. I've done one triathlon. I can't say I'm like well versed in cycling, but I bike to work pretty much from now until October. So it definitely I enjoy cycling a lot. I'm also love doing these community talks. I feel like, especially, going through my experience through pregnancy and postpartum, I had a lot of resources and I felt very thankful to have those resources. But talking to like my mom and other women who in my life, I'm like, there's just not enough people who talk about this. So I really enjoy talking about pelvic health, how women and men can benefit from just little changes in like diet, sleep, and overall wellness that can make big differences on our posture and our overall health in general. So I do a lot of these talks, and I'm very thankful, Hunter, for having me today. And I also, like I said, I'm a mom of this. I mean, he's very young in this picture. He's now a year and a half, which is still young. But he's been like my inspiration on getting back into exercise and really building my community around moms and pelvic floor.
You got to keep up with them too. You got to be healthy to chase him around.
That's right. That's right. You got it. So tonight what I'm hoping to dive into is just understanding like where our pelvic floor is, like kind of like just general muscles in our body so we understand where these things are and how they function and how we can make little habit changes that make a big difference on this area of our body that so many of us, because of going maybe through pregnancies and even everyone having a menstrual cycle and perimenopause and menopause and all of those good things that we are blessed to be uh, have happen to our bodies. How can we keep this area healthy? I think that's always like a big question. And then how do we decrease some of the symptoms that can happen, including like leaking, heaviness, pressure? And then exercises. And I was hoping that we can maybe even try some tonight that could be helpful for cycling specific, to help maintain good core and pelvic floor mobility and just connection. And then, like, when would it be appropriate to seek help from a pelvic floor PT? So let's dive in. Just a brief understanding. I, of course, forgot my pelvic model at the clinic, which I'm so upset about because it is one of those things that you need to see. But don't worry, I have a lot of visuals. If you can just follow with my slides here, if we can imagine this is the front of our pelvis. Can you see my like pointer? Okay. And then this is the back of our pelvis. So like our lower back attaches right into here. These muscles live at the bottom of our pelvis, and our pelvic floor is made up of 3 layers of muscles. So it's a lot of muscles, although they are small, they have a lot of functions that help in our body, and I'll go through some of those. But they surround all of our openings, and they help with continence or the squeeze. They help to hold things in when they want to be held in, and hopefully they help to relax, to let things go when we want to let things go. Um, so I like the picture a little bit better because now we're looking at the front is here and the back is here. And this is like from above. So looking like down into the pelvis. These muscles are some muscles that are inside but can attach outside to our hip bone. So they also help with like mobility in our hips. So if you're ever like, oh, my hips feel tight, especially after cycling or after sitting for a long time, we don't want to say that it's not the pelvic floor that can be influencing that tightness. So these muscles not only sit at the bottom, but they also attach into the hips on the outside. So they can affect how our mobility is in our hips. So they not only surround the openings and help keep everything in, but they also act like a sling from the front to the back. And that sling helps to support our pelvic organs and again, keep everything in, or hopefully we keep everything in. So how does the pelvic floor work? As I said, it sits at the bottom of our pelvis, but it is also the bottom of our core system. And our core system is made up of our pelvic floor being at the bottom, and then our rib cage. Underneath our rib cage is our diaphragm, which is a major breathing muscle. And especially when we're cycling, we think about that muscle, we're pretty flexed forward. So that muscle, we're losing that ability of that muscle to move forward. So being able to really connect to our breath when we're cycling is going to be very important to maintain not only good core control, but good pelvic floor control. And I'll get more into that. In addition to our pelvic floor being at the bottom of our pelvis and kind of being the bottom of our core system, it also modulates pressure. So when we go and we hold our breath, we are pushing down on our pelvic floor. And then when we breathe, we're also influencing our pelvic floor. Now, although we don't feel it, our pelvic floor moves every time we breathe, or at least we want it to move every time every time we breathe. So if we have more tension into our pelvic floor, sometimes it doesn't move the way we want it to. So I'll kind of talk more about that. It also helps to stabilize our lower back and our pelvis. It is one of the major muscles that helps with our posture. So if our pelvic floor is weak, it can kind of cause our pelvis to tilt forward or tilt back. Or sometimes a lot of our patients have lower back pain because the pelvic floor has weakness. So it can contribute to a whole plethora of issues, including lower back, hip pain, or abdominal wall, AKA your core muscle weakness. So to say it is not an important muscle in our body, I mean, come on, ladies, do you know of anything else that does this many things in your body? And I didn't even touch on it holds all of our pelvic organs in place. It's a place of sexual function. So we get some fun down there, hopefully. And then also bowel and bladder habits, like that is we need this to function in order to have our stools be able to come out when we want them to come out, and our bladder to be able to be held and also let go when we want that to happen. So if we can imagine a tube, like almost like a hose, and then our pelvic floor at the end of that hose, if our pelvic floor is clenching on that hose, we're going to maybe have some drops coming out, or maybe nothing at all. If our pelvic floor is very relaxed, we're going to have a lot coming out of that hose when we don't want it to come out of that hose. So it's very important that it knows when to contract and keep the water in the hose, or relax and let the water out of the hose. You get my drift. Main takeaways from here is that it contributes very much so to posture and to breathing function. And breathing is going to be really important when we talk about cycling, and I'll get into that a little bit more. So as I said, the pelvic floor is the bottom of our core system. The other muscles are our diaphragm. And again, that lives underneath the rib cage. So that's at the top, pelvic floor bottom, diaphragm at the top. Our lower back muscles are on the back of that core system. If we almost imagine like a soda can, bottom's the pelvic floor, top is the diaphragm, the back is our back muscles, and then the front are all of these awesome core muscles. And a lot of the times people be like, do I think I have a weak core? And it's like, okay, why do you say that? I say that because I feel like when I do core exercise, I don't know if I feel it. Or I say that because I've had a history of back pain and I have a hard time engaging my core. And I would say, yeah, that makes sense because all of these things are so interconnected, but very much so play a role in why things might be dysfunctional, aka having lower back pain, or aka maybe not feeling why our core is functioning the way we want it to. So there's a lot of different muscles that make up our core. And again, all of those play a role in how our pelvic floor is functioning as well, the strength of them and the mobility of them. So I hope this is like, I use this image probably way too much. I mean, I wish I had royalties to it because I just love it so much. Whoever created it, God bless, it's amazing. But I think for me, at least, looking at something visually, I feel like that's how I learn and how I educate my patients and just understanding kind of what I was talking about with that soda can analogy. So if we think about the bottom is our pelvic floor, the bottom of that soda can. The top is our diaphragm, which is lives underneath our rib cage. This is our spine, so this is the back of our body, and we have muscles that kind of line the sides of our spine. So that's the back of our core system. And then the front is our abdominals or our actual like core. So as we breathe in, that diaphragm comes down and the pelvic floor also comes down. I wish this image was a little slower. It's very fast, but that's my only qualm. Okay. As we breathe out, the pelvic floor lifts and the diaphragm lifts. So those two things move together, or we want them to move together. Now, how many of you have, like, when you're thinking about, okay, breathe in, suck in, you like automatically are like, wait, who's done that before? Or who has taught that? I remember my grandma, stand up tall. I'm like, fucking okay. This is how I do this, right? And actually, physiologically, that's not how our body was made. So a lot of the time, patients that are coming to us are like, wait, how do I breathe? Have I been breathing wrong my whole life? And, it's just kind of like how maybe we've been taught, or even how we've just like accommodated to changes that have happened as we've become more active or less active or have had children. So, thinking about as we breathe in, if we can almost think about filling our rib cage and our belly with air, that is going to help our pelvic floor relax and also come down. So if we can kind of reframe how we breathe, that can be very important with how our pelvic floor and core functions. So again, as we breathe in, and feel free to do it with me, you can kind of put your hands on your rib cage. As we breathe in, we should be thinking about breathing into our hands. And as we breathe out, almost like a balloon, think about the hands coming back into the starting position. So again, taking another breath in, seeing if you could really fill your rib cage with air. Does that feel normal? Does that feel natural to you? Or does that feel kind of challenging? And then as we breathe out, coming back to that starting position, letting the rib cage relax. Now, again, this might be something that you're trying and you're like, this feels very foreign to me. And I would say, especially if you're someone who maybe has a pelvic floor related concern, issues with bowel or bladder that you could think of, pain with intercourse, lower back pain, maybe feeling weakness in the core. This is a great place to start. Just thinking about how we're breathing. And in addition to that, when we breathe, obviously it happens naturally, or we hope that it happens naturally for most folks. But a lot of the times it is influenced by what's happening in our environment. So, for instance, I'm in Target with my 1.5-year-old. He wants to get out of the cart. I'm like, please, no, don't do this to me. Then he's like, okay, fine, I give up. I'll get you out of the cart. Okay, now he's running everywhere. I have 5 million things in my hand. I'm sweating. What do you think's happening to my pelvic floor? It's like, "Ah!" so tight, clenched. It's just responding to what's happening in the environment, and it is responding to that. And not everything in your body does respond the way the pelvic floor does. Is very intimately connected into our nervous system. So that's why breath work can be something to help relax our nervous system. So at that point, you can only imagine my pelvic floor being like, ah. But if I am on the beach with a pina colada in hand and nice and relaxed, you can best believe that my pelvic floor is probably also relaxed. So, reminders that our pelvic floor, in addition to other muscles in our body, are can be very sensitive to not only things going on in our environment, but situations that we're faced with. So, if you're feeling like you're one of those people who've maybe notice, oh, my back hurts more in a stressful situation. I feel like I can't go to the bathroom when I travel as much because maybe I don't know where a bathroom is or it might not be clean and I feel more constipated. That could be something that can be influencing your pelvic health. So, to help with that, you can one, work on deep breathing, two, do some of the exercises we're going to talk about, and three, just develop some strategies that have been helpful for you in the past to kind of get you to just reset. Because those situations are going to happen. And the more that we kind of find that reset for ourselves, the more we can help our pelvic floor. So, moving on from the nervous system, this is my favorite slide because I feel like so many people take away like the Justin. I mean, I don't know about you, but I mean, who has been a victim of go to the bathroom before we leave? You don't know when you're gonna go again. Like, come on, raise your hand. Raise your hand. My mom did it to me all the time. I am like, please don't do this to yourself now. Don't do this to your son. But like it happens, right? So it's going just in case. Now, yes, like a road trip, maybe that is the one situation, unless you tell me you go on a road trip every single weekend. Maybe that might be something that would influence your pelvic floor. But if you're going to the bathroom before you're leaving somewhere or going just in case, fill in the blank, that might be something that can influence how often you're going, how maybe the ability to control your bowel and bladders. So something to keep in mind. Our bladder should be telling us when to go to the bathroom. Oh my gosh, I feel full. I feel like my body feels like I have to go to the bathroom, right? I'm not telling my body to go to the bathroom. So getting that signal from my bladder to my brain is going to be what we want to happen, not our brain to our bladder. Because if that signal gets confused by our body, then we're like, wait, do I have to go to the bathroom? When's the last time I actually went to the bathroom? I've been sitting in front of my computer for 5 hours. Oh, wait, did I drink water? Right. So, like, you kind of like maybe will feel really thirsty or not thirsty at all. Or your pelvic floor can get confused and maybe not relax when we actually have to go to the bathroom, right? Because of that hose going through the muscles, right? So if our muscles, if our bladder's never full and putting pressure on our pelvic floor to tell it to relax, and our brain is saying, go just in case, then our pelvic floor might say, wait, I don't feel that pressure. So should I go or should I not go? And our pelvic floor might be like, all right, I'm going to relax, I guess, because you're telling me to. Or it might be like, I don't know if I can relax. So something to keep in mind, avoiding just in case peeing is like the best thing that you can do to help your pelvic floor. Another thing is avoiding pushing or straining when you go to the bathroom, and that is bowel or bladder. I spoke to a one of my patients. She's a doctor, and she was telling me she works in the emergency room, which obviously can be a very stressful place. She's like, "Yeah, my pelvic floor is probably like clenching all day long with the stress I deal with." And I'm like, "It is a very stressful job." And she's like, "I don't drink water because I don't know when I'm going to go to the bathroom again. And then when I do go to the bathroom, I sit on the toilet and I'm like." Okay, push, like be done as fast as possible because I got to get back to my patients. And that pushing and that straining, going whether you're going number one or number two, can imagine your pelvic floor is like, why are you pressing on me? Wait, hold on, I'll relax. Don't do this to me. So if a muscle is getting pressed on and it doesn't want to, it's going to contract against that to protect us. So all joking aside, like pushing down and straightening can be irritable to the pelvic floor. So something else that can be like an easy fix, let me see if I don't push or don't straighten, is this going to be helpful? Excessive smoking can affect your pelvic floor. Obviously, any type of weight change can impact your pelvic floor just because it is a postural muscle. So, changes, especially I talk about this for my pregnant patients because now we're having so much more weight forward. Our pelvic floor wasn't used to that weight forward. So, now we need to think about okay, how does my core and my pelvic floor support that weight? And that can change how our pelvic floor functions. And a lot of the times people be like, I got to go to the bathroom all the time. And it's like, well, now you lose the core. So your pelvic floor is working overtime and there's a lot more weight on your pelvic floor. Sleep quality is always something that's going to affect how our muscles heal and recover and work. So maintaining a good sleep is important. And then pressure management strategies. What that means is if you're one of those people who maybe is like pushing down when you're going number two or pushing out when you're maybe having to uh, expel gas, that might be something that we want to try to avoid because, again, that's that pressure on the pelvic floor. Another thing that I see with people who like to lift weights, and even it could be light weights, like you're doing some bicep curls, is they go and they hold their, and then they relax, and then they hold their breath, and then they relax. That's called bearing down. You're putting pressure and you're holding pressure internally, and that pressure internally is going to go down because of gravity. And when it goes down on our pelvic floor. So when I say not bearing down, it means not pushing down. And a lot of the times I say that with exercise because that's the main time when that's happening. And I think for cycling, it's one of those things when you're in that hunched over position, it's easy to kind of like hold your breath and push down. So if you are one of those people when you are cycling and you're experiencing like a lot more pressure or tension in your abdomen, or you're noticing that, yes, maybe you're on a seat for hours. So obviously those muscles are going to feel tender because you're sitting on a seat that doesn't have a lot of surface area usually. But if you're noticing that that's affecting your bladder or bowel habits after a ride, I might be thinking to advising you to say, am I holding my breath when I'm cycling? Am I really trying to inhale through my nose, exhale through my mouth the best I can? Or am I like holding my abs in, right? Which can create pressure down. So something to think about. And I'm going to go into that specifically in a second. Other things, like I kind of said, like I want you to feel like you're in control of your bladder. So if you're feeling like, oh my gosh, I just went to the bathroom, I walked away, I did something, and oh my God, I feel like I have to go again. Like I literally just went. This can happen when the bladder is not like say we're telling our bladder with our brain, hey, go to the bathroom, I'm about to leave the house, or hey, go to the bathroom, I don't know when I'm going to go again, or hey, go to the bathroom, I'm going to bed and I should probably go before I go to bed. Even though maybe I didn't drink water, right? You're telling your bladder and your bladder's not telling your brain. So now this confusion can happen. And that's when we maybe say, I just went to the bathroom. Why do I have to go to the bathroom just again? Right? If I just went and it's 7 o'clock and now it's 7:05 and my body is maybe telling me I have to go again, do I actually have to go again? Or is it something that's happening where my brain and my bladder are getting confused? So that's what I mean by that. And it's like, if I could say, hey, I just went, body, I'm okay. I'm going to try to hold it. I'm sure if you try to do that, your body will allow you to do that. So, a technique we teach people a lot is called freeze, squeeze, breathe, and ease. So, what that means is if you're one of those people who went to the bathroom, okay, did my whole bedtime routine, now I'm going to go lay down, and you're laying down, you're like, oh my God, I feel like I have to go to the bathroom again. I want you to try to freeze, take a second, squeeze, try to squeeze your pelvic floor. And even if you don't know what that feels like, I want you to think about like pulling your belly in towards your spine because that does help to engage your pelvic floor. Because remember, they're all connected. And then you're gonna take a breath and let it go. And that should just help to like calm down those muscles. Sometimes if the brain and the bladder is getting a little confused because my brain's telling my bladder one thing and then my bladder is maybe telling my brain another thing, it can cause confusion, and that's why you might experience that. Let me know if you have questions about that. We can talk more about it.
I have a question about freeze.
Yes,
What do you mean about that? Like just freeze, like don't think about it, or like you
freeze
freeze.
on where you are. Like that's a really
Oh,
good question. Like
like
a lot of the
stop.
times people be like, "Oh my God, I feel like I have to go to the bathroom. I'm going to start getting up and going."
It's usually when I'm in bed at night, because
Yeah,
I drink
exactly.
water
Or
too
like say like
bad.
in the middle of the night, right? Like the middle of the night's
Yes,
very
it happens
common.
all the
Like
time.
it's like, oh my gosh, okay, I feel like I have to go. Do I actually
Right.
need to go? Did I drink a lot of water before bed? Maybe I did, and I only went to the bathroom
Yeah.
once, and that might be
Okay.
okay, maybe why I'm waking up. But maybe like I just had like a small cup of tea, 8 ounces, and like that's all I drank for the last 2 hours. Does
Mhm.
it make sense for me to have to wake up to go to the bathroom? Now, if you're someone who's done that over time, like every single night you wake up, your body might be just ready to do that. But your bladder, when you go, you're like, well, I just went for like 4 seconds. That was really nothing. So in that instance, especially if that sounds like you, I'd be saying, okay, let me just freeze. I'm not going to get out of bed. And then I'm just going to try to squeeze. Can I squeeze everything for a second just to like give that
Mm.
input into our nervous system? It actually does create safety because when we like engage our muscle, it brings blood flow into the area. And then as we relax from the squeeze, the blood flow kind of
Mm.
lets go. And then we take a big breath in
Okay.
and into our belly to like really like get rid of like even that tension or feeling like you have to go to the bathroom and then see how that works. Now, if you're like, hey, Juliana, I tried this stuff and it did not work for me. What else you got? Don't worry, I have plenty of tips.
Okay.
And I do this virtually with a lot of people. I actually have someone in Philadelphia right now, a bunch of people in New York because I used to live there. And then I actually have two random people, one in Germany and one in Italy, that like found like they're like family
Cool.
members of friends who found me and are like, can you help me? I am waking up like 10 times at night. I'm like, I got you. So this is something that we can do virtually if this is really an issue or a problem that you are like, I tried the things, they're not working. How can you help? I got you. Everyone deserves to sleep well. That's how I always feel. But in
Okay.
addition to sleep, hydration is very important. And you might say half of my body weight in ounces of water. What? That's a lot of water.
It
And I'm like,
is.
if you don't have a 32-ounce water bottle and you are an athlete, you're doing your body a disservice. Because if we're thinking about half your body weight, let's just say that's 72 ounces of water. We have 8 ounces in a cup. You're talking about 10 to 12 cups of water a day. That's a lot of water. So if you can get 32 ounces and say, okay, two is a great goal, but three of them is like gold star. Like that's good. You're doing the right thing, but you got to get the big water bottle because glasses of water just feel like it's like endless water. Practicing deep breathing, like we had kind of spoken about, is something that can really be helpful for the pelvic floor. And then being mindful of diet. And I'm just going to briefly go into this. I am not a dietitian, so I'm not going to go crazy with recommending any foods. But we do know these are research things, especially the first three, that bladder irritants are alcohol, beer and wine included in the alcohol, carbonated drink, and caffeine. Like those are the big four. Like if you have ever had a drink and you're like, oh my gosh, gotta pee, breaking the seal, oh, small bladder alert, whatever you've used in the past, it's true. It irritates your bladder. So it is going to make you go to the bathroom more. Same with caffeine. It is a diuretic. It's going to make you go to the bathroom more. But if you are that type of person that has an alcoholic beverage, has a carbonated drink, or has caffeine, and you're like, okay, I drank this thing at 7:15, 7:30, I'm going to the bathroom, which is a very short window. And then maybe I'm going again at 8:15 and 9:15 and 10, and it's like every hour. We say that as being an irritant. Like that is something where if you're going to the bathroom more times than 2 to 3 hours, then you're going too often. Like we should be going every 2 to 3 hours. So every hour is a little, we can almost call that like urinary frequency. And that could be again something because your bladder is irritated or because of something else going on in your pelvic floor. But something to keep in mind. Now, I'm not a big proponent of get rid of the coffee altogether. I hate to do that. I love coffee. I'm never gonna make you do that. But if you notice that you are drinking your cup of coffee and then going to the bathroom right away or going very frequently afterwards, I would consider adding in some water. And a lot of the times I say water first, then coffee, then another water. And you're like, well, when do I have time to do that? And I'm like, yeah, you're preach to the choir, because getting my 1.5-year-old out of the house, plus myself dressed, plus like cleaning up crap before I can get out to be there for my first patient. I hear you. I get it. That's why I have my 32-ounce water bottle. And that is also why my coffee is less than my water. It's all psychological. And I think a lot of the times our pelvic health is very psychological. So it's a mind game you're playing with your bladder and your body. So set yourself up for success, have the water nearby. And if you notice any of these foods are causing you to have any differences in your bowels and bladders, something to think about, that you're might be more sensitive to them. And I like this bottom one. Look, empty and happy, full and cranky. And you want your bladder to be able to fill all the way up. Like usually our bladder signals that we have to go to the bathroom at 80%. So and that means that you're going to the bathroom for 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi minimum. It feels like a long time, right? Doesn't it? And if you're emptying your bladder and you're not noticing you're going for that length of time, one, maybe your bladder is not completely full. Two, maybe you're getting an urge to go to the bathroom before your bladder is completely full because of some of these habits that you're like, do I do that? Oh, maybe I do that. And that's okay. I'm here to tell you, I don't got it all perfect either, but I hope that after you leave here today, you could say, maybe I work on a few things and this can help fill my bladder, keep my bladder healthy, and keep my pelvic floor healthy. Checking in with your posture is going to be really important too, because as we talked about, like our pelvic floor is very interconnected with our posture, right? So it not only affects like from the belly button down, but it also affects from the belly button up. Because if our back is arched like this, I call it the Beyonce booty pop, then what's happening to everything above? Right? Our rib cage is flared out, our back is kind of arched, right? And again, most of our society is unfortunately like this because we all sit on our computers. But that affects what's happening down, right, into our pelvic floor. So I always tell people, like, when you're sitting and working, especially if you're working from home, like, get all the things to help support your body. Like, I like having something in your lower back, like a lumbar support pillow. And I like you to make sure that, like, by the end of the day, you're not feeling like you're slowly getting closer to the computer and then all of a sudden your eyes are this close, right? So setting yourself up for success can be really helpful by just thinking about where your posture and your body is in space as you're doing your day-to-day tasks. And that can really help to influence your pelvic floor. Okay, so cycling. Again, please, I'm not an expert, so I love your input here, folks. Please. But when I look at this person, I'm like, look at her posture, right? Like, I don't know if it's ideal. It looks pretty good for cycling. Quote me if I'm wrong.
Is that you,
Okay.
Hunter? Is that you in that picture, Hunter?
Not exactly. Looks like a fast lady, though.
But I'm like, look how flexed she is, right? So you're in this flex forward position. So when we're in that flex forward position, it's putting a lot of pressure on our abdomen, right? We got to remember the canister system, right? Bottom pelvic floor, top diaphragm, front core, back, lower back, right? And now we're forward, right? So now there's a lot more pressure here. So where does all the other pressure go, right? A lot of the time, because of gravity, it's going down. So when we're cycling, if we're like breathing and we're like into our shoulders, our pelvic floor is never moving when we're breathing. And we want it to move. Now, you don't feel this, but we want to be thinking about, can I take a breath into my back? Can I take a breath into my rib cage? What does that feel like? That might feel really hard and really different than when you normally breathe when you're cycling. And it is hard to breathe when you're cycling because you're in this flex forward position. So something that can be helpful is working on some of these exercises that we'll get into to just help to like get your body used to breathing into your back. So breathing into your back can be very helpful to maintaining good pelvic floor health. Oops. And then Also, like we spoke about, staying hydrated during your ride is also going to be important, right? So especially Hunter, how long are you guys going at? Like, what's like a long ride look like? Like how long? Like minutes or hours?
Oh, I mean, 4, 5 hours, like
Yeah. And
near
are
the
you
peak
guys
of the
doing any
season.
stops or what's that kind of?
Yeah.
Yeah.
I mean, I think everyone takes a various number of stops. If I'm going on a 4 hour ride, I most likely will find a coffee shop.
Yeah, definitely. And but think about this, ladies, you're going on a 4-hour ride. You might be somewhere that doesn't necessarily have a bathroom, or you might not know when a bathroom is going to be coming up, or if anyone will stop with you, right? And you're like, I don't want to slow the group down. However you might feel, right? You might say, well, know what? I'm just not going to drink water. I'm good. One, that's not good for your muscles. Your muscles need to stay hydrated when you're cycling. It's a big demand on our body. But two, the pelvic floor. Because now we're thinking, okay, well, where am I pulling water from, right? A lot of the times when we're cycling, we're sweating, so we're losing water. And then now we're not taking in water, so we become dehydrated. But also, the next time we do drink water, especially say we restricted water for our whole 4-hour ride, which I really hope no one is doing, but say you do, the next time you drink water, your bladder might be like, oh, I'm full. And you're like, well, I only drank like 4 sips. Why do I have to go to the bathroom right away? And your pelvic floor may and your bladder may get confused because there was no input into the bladder for 4 hours straight. So something to keep in mind that even if we take some small sips, which might be something that you feel more comfortable with, and usually I do recommend than like going for a huge gulp, that can be really helpful to just maintain good pelvic floor health while you're on a long ride. Questions about that?
I don't have a question, but I'm gonna drop a YouTube video in the chat. Um, this is Taylor Knibb. She's arguably the best American triathlete in definitely the country, but in the world. She's winning 70.3s left and right, went to the Olympics. The start of this video, she's with her strength coach, and I'm not sure the strength coach's background, but there's this whole part on how she's laying on the floor doing all these breathing exercises to mimic being on the bike. And it's like super cool that it's like being
Awesome.
shown in someone that's at the top of our sport. So it's a cool
Very
video.
cool.
Yeah. So it's
Very
nice to
cool. Do you
watch.
want me to play it? Do you want to play it now or do you want to throw it in at the end or you want me to see it later? I'm definitely interested.
Yeah, just watch it later. It's cool. Like
Okay, very
I just
cool.
appreciate when someone is at that level and like doing all this stuff too. Like she's not just swimming, biking, and running.
Yeah, that's awesome. It's so important. Like the little things I think that are missed with pelvic health is really focusing on the breathing. So, I don't know how you all feel about moving with me tonight. And again, you don't have to. I could go through these pretty briefly. And you guys could always watch in the recording and kind of follow along on your own. But I have 4 exercises that I thought would be helpful for cyclists. Again, not being a cyclist myself, I'd love feedback from this so I could always make this better in the future. But I think, again, like being in that forward flexed position, being able to breathe into your back is so important to maintain good pelvic floor health and good core and lower back health. So, a exercise I really like is the child's pose. So, of course, this goes in every single thing. But okay, so I'm going to get into my spot just to show y'all how to do it. And again, if you want to join me, feel free. Um, so, everyone knows the child's pose, right? We kind of get into a hands and knees position, and then we rock back, sitting our hips back and bringing our arms forward, right? Are we familiar with this?
Yeah.
Yes. Okay.
Yep.
So in cycling, because we're so flexed, this area of our back really we need to get air into it. So you can practice by grabbing a pillow, a towel, or a yoga mat, and you kind of place it like right underneath your ribs. And you just, instead of we're going to kind of like rainbow our body over that pillow and then we come down. So now, like my whole spine is kind of rounded. I'm sorry, I'm wearing black. It may be hard to see me. Let me know if you need me to change my angle. But now, when I'm here, I can't breathe into my ribs as well, like in the front of my body, because the pillow is blocking my ability to do that. So what happens is as I breathe in, I feel a lot more air coming into my back. And this can feel really nice to help open up the back of my rib cage, especially like around the bra line, the lower back. Like for me, I feel this so much in my lower back. It feels really good. And in this position too, you might also feel like a little bit of stretch into your neck, which feels great. And we're just taking a nice big breath in, open mouth, exhale. And you'd hold this from anywhere to 2 to 3 minutes. And this could be something that could be great to do as a warm up before you go cycling, again, just to get some more movement into the back of the rib cage. The next one that I see with cyclers who I've worked with is because we're constantly in this position, our inner thighs, which I haven't mentioned tonight, but those are also, of course, very close into our pelvic floor and connected to our pelvic floor. So something that I love to recommend before you go on a long ride is just opening up the inner thigh muscles. So this is called an adductor, which are the inner thigh muscle names, rocking. So we go into a hands and knees position, we kickstand one leg out, and then we slowly shift back into like a, again, into almost like a child's pose. My back foot, my toes are tucked under. And as I sit back, I might feel a stretch into my foot, but also a nice big stretch into my inner thighs. And I kind of go back and forth, nice and slow here, taking a breath in as I sit back and taking a breath out as I rock forward. And this can be feel like a really nice inner thigh stretch. And the breathing here is very important. From the side view, just so you can see I'm here, kickstanding the leg out and then sitting back. And my toes on my foot that aren't kickstand out are tucked under, so I can feel a nice stretch into my foot, which may feel good, especially when we're cycling and we're wearing shoes and our foot is so rigid for so long. Like just getting some stretch into your feet can feel really nice, which lo and behold also can influence our pelvic floor. Surprise, surprise. Our pelvic floor is connected, everything's connected. So another one I love, again, because we're so flexed when we're cycling, we want to do the opposite thing too. That actually feels really good for our spine. So for this next one, you're in on your stomach, legs are nice and straight, and we're pressing with our arms to come up, extending through our lower back. And this can feel like a really nice stretch through our core muscles, our abdomen. And in this position, we're breathing into our belly. So doing pretty much the exact opposite of what we did in the child's pose. Now we're going to take a breath into our belly and then slow exhale, open mouth. From the side view, just so you guys can see me well, I'm sorry, I'm kind of in a small space because I was hiding from my son. Um, we'll come up like this just so everyone can see me. All right. And you hold that position. If this doesn't feel comfortable for your back, don't go up as high. It's okay to not go up as high. This should feel like to your comfort. You can feel a little bit of like pressure into your lower back with that one. But the big thing we're working on is like just trying to get some air into your abs. So sometimes I've had folks who are biking for a long time say like, oh, my core almost feels like a little spasmy. This might feel really nice to like relax that. The last one I have for you guys is like honestly my favorite. And I think just honestly, everyone should try this because we just sit a lot and it feels really nice. It's almost like a pigeon pose, but it's a modified pigeon pose. So we bring one leg in front like a regular pigeon, but the back leg is also bent. So a regular pigeon pose, the leg would be straight. This time the leg is bent and we're bringing our torso towards our foot. And like I had mentioned, the pelvic floor muscles also go into the hips. So this can be really helpful to not only loosen up your hips before or after a ride, but also to just help to loosen up the pelvic floor. Now, notice how none of my exercises were Kegels. Just saying. Any questions about those? So a lot of times people ask me, should I do this before or after? To be honest with you, it depends. I think what's your goal? Is your goal to loosen up before your ride? Is your goal to cool down after your ride? You can do them before and after. There's really no like prescription on when. It's more about like what your body needs. And a lot of the times people are like, oh, I want to do this breathing one before just to like prepare my body for the ride. And maybe I want to like loosen up my inner thighs for the ride. And then afterwards, wow, my abs do feel like tired from being forward. Let me like do this one and keep my hips loose. So I want you to decide what feels good for you, but I hope these four would be good to add into your routine. Okay. These are questions that I want you to just think about because sometimes I think people are like, well, I think my pelvic floor is fine. Like, yes, maybe I could stop avoiding just in case peeing, or maybe I can drink more water, sleep better. But like, these are things that patients come to me with often and might be like, should I get help about this? This might be time too. So do you have urgency to use the bathroom more frequently when you're out cycling or just out in general, working out? If so, your pelvic floor might be involved. Do you feel like it's difficult to hold in urine when you're coughing, sneezing, or laughing? Do you ever leak urine or have heaviness into your lower abdominals or pelvic floor, especially when you're doing like jumping type activities or running? Do you go to the bathroom and then feel like you have an interruption in your stream or a steady stream? If you're feeling like you're having an interruption or you're feeling like you have to go and you just went, that might be a good indication that something might be going on in the pelvic floor. I kind of repeated myself again with the heaviness and pressure there. And then, do you have a difficult time controlling urges to go to the bathroom? So, yes, in the middle of the night, that does count, but also throughout the day. So, both of them, like, how well can you control that? And if you have tried to control it and it doesn't work, maybe that's a good reason why you should say, maybe I should check in on my pelvic floor and try some of these strategies. And then we talked about straining when you're emptying. We want to make sure that we're not doing that because that's not the greatest for our pelvic floor. Pain during intimacy, which I talked to so many people about this, and is something that I want you to have a positive experience in. So if you are having pain, there is something that you can do to help, and that is pelvic floor PT. And then, are you feeling excessive pressure in your lower abdomens when you're cycling, especially those longer rides? If you are feeling that pressure, that pulling, that cramping feeling in your abs, that might be a good reason why to get help from a pelvic floor physical therapist. And so, what can we do? I mean, how can pelvic floor help? 75% of women who experience significant improvements in their symptoms of incontinence, so leaking, with the appropriate diagnosis. So, just understanding like, where is this coming from? That's just like getting the right, like knowing where it's coming from. That's not even saying like with the appropriate exercise prescription, right? So, that's just understanding where it's coming from. 75% of people get better, which is so awesome. And then in our sessions, we also talk about like what is your whole medical history? Because I've had people who've had C-sections or abdominal surgeries or hip surgeries, and then they have pelvic floor related symptoms later on in life, or even subsequently to those surgeries. So something to think about. Other things we do in PT are like normal PT, right? We look at your posture, we look at your strength, we look at your mobility. So we're not just looking at your pelvic floor, we look at your whole body and you as a whole person. We also do bladder or voiding diaries, which helps us to record when you're going to the bathroom so that we understand like where your bladder habits are. And then if we're in person, we do some manual techniques and dry needling, which is very similar to acupuncture, which can be very helpful in treating some of your symptoms. And then we give you exercises to help with the goal of being symptom free. So big takeaways. Our pelvic floor is so interconnected with our body. Like I really hope like this can help bring some light into, wow, I really like, how is my pelvic health? Because it plays such a big role in how we breathe, how our nervous system functions and responds to stress, how what's happening when we're cycling, bowel and bladder habits, intimacy, you name it, right? So many things. So just working on some of these little behavioral habits and then some of these stretches and breathing exercises can be really helpful in maintaining good pelvic health. And then understanding how to manage the symptoms, which if you took some things away and you want to try them on your own, awesome. But also we are here and we do offer virtual services. So I'm always happy to answer any other subsequent questions. And again, I am from Pacer Physical Therapy. I'm the founder, and we're based out of Boston. So that's us. That's some resources. And I would love to open up a Q&A, any questions. And again, like, for me, nothing's TMI. If you want to share it, I'm open to talking about it. So thanks again for having me, guys.
So good.
Thank you.
Thank you.
Do you guys have any questions?
Well, I have a question. It's just a situational thing where I like to jump on the big trampoline with one of my grandsons. And I notice when I start, I don't feel like I have to pee. But once I start jumping, it's like, oh, time out. Let me go empty my bladder. I do that, and then I can continue jumping. So is that a concern, or is that just, I'm 67 years old and I don't know.
Yeah, I love these questions. These are great. These are great. I think so. One thing to keep in mind is, when did you drink any fluids? Does it feel like it's an appropriate time to go to the bathroom after you drink those fluids? Or is this like an every time I go, I start jumping and then I have to go? These are just questions I'm asking. Like, you don't have to say them out loud. I just want you to think a
No,
little
I'm
bit.
always hydrating with water. So, it's random when we decide to go jump on the trampoline. And I've just noticed I just can't do it for more than a minute. It's like I gotta go take a pee break. So now
Yeah.
before I jump on the trampoline, I just automatically go, even though I don't feel the need to go.
Yes.
So
Okay.
I'm not sure
And
if
does that
that's,
help, or do you still feel the urge to go?
oh, it helps. It totally helps. But I'm thinking about you talking about going every 2 to 3 hours, not forcing it, wait until the bladder's full. I'm not sure my bladder is full. It's just that my bladder doesn't like to be jumping on the
Yes.
trampoline with
Sensitive
anything in
to
it.
it.
Yeah,
Yes, sensitive to it. So a lot of the time when it comes to impact type exercises, jumping, running, things where we're like really like bouncing or
right.
moving, that is a pressure management thing. So it's the pressure from jumping on the pelvic floor that's telling us, uh-oh, it's almost like that sensation like your bladder's full. It's that pressure on there that's saying, I should go.
Mhm.
Now, I encourage you to try. Okay, I know your grandson's probably, you said grandson, right?
Yeah.
I know your grandson's going to continue to jump and you're going to be like, hold on, I'm going to just like take a second. And he's going to be like, come on, keep jumping with me. So I want to be realistic with you, but maybe we try to get off of the trampoline, do like let me breathe in, let me squeeze my core, let me then relax, and then see if I can go back on it if that helps.
Could try it.
Again, you're just distracting and then you're going back on.
Yeah.
And you're trying the squeeze or the freeze, the breathe, the squeeze, and then the go back on. And maybe just that little input can be helpful.
Yeah.
Now, if you're like, okay, I tried it and I go back on, I'm bouncing. Oh my God, now it's 2 minutes later and it's happening again. And I tried it again. Then, okay, how many times do you want me to do this, Juliana? This is getting crazy. I'd be like, okay, let's try to do this. How does it feel if I do some core exercises, then go and bounce?
Yeah.
Like, seriously, okay, I know I'm going over with my grandson. Let me try to do some core exercises, then let me go. Does that help? Or let me try some stretching and then I go and I bounce. Does that help?
Yeah, I could try
Something
it.
to think about.
Yeah. I mean, that technique I think is really, for me, is going to come in handy in the middle of the night, and I don't want to get
Yes.
up to go to the bathroom,
Yes.
just
Yes.
go through
And
that.
a big thing in the middle of the night too that I always recommend people to do is like, okay, I tried the freeze, I tried the squeeze, I tried the breathe, and I still feel like I gotta go. This isn't working for me. What do I do? Maybe you do need to distract yourself and get up and like walk somewhere that's not the bathroom. Or you need to like give yourself some input and like just kind of cup your hands over your eyes. That can be really relaxing to our nervous system. Another thing is like breathing in and counting. So 1, 2, 3, 4, 1, 2, 3, 4. And again, it's just distracting our body, especially if you're like, hey, Juliana, I didn't drink 32 ounces before I went to bed. Like, and I went to the bathroom before I went to bed, and it's only 5 hours in. We want to train our body. Now, if you tell me, hey, I've been waking up every night in the middle of the night for the last 10 years, it might take a little while, but it's not something that you can't work on. Like, I mean, I'm actually working with this man who was waking up 7 times at night.
Oh my
Seven
God.
times. We
Sounds
worked
like his
we,
prostate.
yeah. So he was like, got every test in the entire world. Thankfully, everything actually came back normal. So his friend at Thanksgiving dinner was like, "You got to go see my pelvic floor routine." And I'm like, "This is great. People are having these conversations. I'm thrilled." I've been working with him for 3 months. He wakes up twice.
That's awesome.
And he only wakes up twice because it's like, he goes to bed 3 hours later, he wakes up. And then he sleeps a big stretch. And then it's like wakes up maybe like an hour before he actually wants to wake up. So it's like we're getting there and we're getting like 5, 6 hours of sleep, which he hasn't gotten for over 10 years.
Right, which is improving his quality of life for getting quality sleep.
He's not only decreasing his risk of cardiovascular disease, decreasing his risk of cancer and other like diabetes, all of these big
Mm.
things that we know are influenced by sleep. It's like it's literally changing his quality of life. So like I just like that's the biggest thing. I'm like there are things that we can do to retrain our body, and I like waking up in the middle of the night. There's so many great strategies I have. So I want you to try it. You let me know how it feels, and if you need more help, I'm always here.
Thank you.
Yeah, mine's before bed. I'm trying to decrease it.
Yeah. Yeah.
Because I'm like, the last thing I want to do is get up in the middle of the night.
Right.
I know, but but think about it. That's our fear, right? I'm
Yeah.
fearful of that. I mean, especially like when I was like really pregnant, I'm like, oh my God, again. I'm like, it's like, and I'm like, wow, it gave me a new perspective on I'm like, okay, like, how do I respond to this? And you might say, all right, I'm going to try to hold it. And then your whole body is like sweating. You're like feeling more anxious. You're feeling more worried. And like, there are a lot of coping strategies that we work on. Like, everyone is going to be different, but it's definitely something like, I hear you. Like, you're like, oh, I don't want to wake up. What can I
Yeah.
do?
And I think it's
But
the same
trying to
like thing before I race too.
yep,
It's
yep,
like I go to pee like 5 times. I'm like, thank God for triathlon because we swim first.
yep, yep,
Sometimes I think it's the adrenaline and the excitement of a race because it
that
causes
too.
all the systems. It's like your body wants to evacuate all the
Yep,
waste, you know,
yep.
or at least, I feel better if I start on empty.
Definitely. I
Yeah.
think I run like at least I run at least five races a year I'm running. So and I think about different distances too. I'm like, oh, 5K, I'm good. 10K, toss up, half marathon, definitely going.
Yeah.
But it is one of those things that I think the more you train your body to get your bladder to fill fully, the less sensitive you will be. Where if your bladder is 50% full, you won't get that urge, right? Your body won't say, oh, I feel like I have to go to the bathroom, right? You might feel it in the background, but it's like not loud enough that you want to like answer the call. And I think if you can keep training your bladder and your body to say, in situations where you feel safe, where, before bed at night, like, there's a bathroom there in your home, that it's probably going to be available and your partner or someone else won't be in there. Those are the situations where you feel safe. I would say when you feel like you're ready to do this, try it. Like, how does it feel to be like, all right, you know what? I went to the bathroom and now it's only 20 minutes later and we're going to get ready to go to bed. Do I really need to go again? Try it. I think you're going to be surprised if you do it like 3, 4 nights, your body's going to get used to it and you might not wake up. So it's just you got to be ready to do it. It's not something that I'm going to force on you or you should force on yourself.
Yeah.
But anything else with cycling that would be helpful to know, like pelvic health wise? Like, are there people that ever like say, like, my inner thighs feel tight or like they feel like any like pressure down there, especially after a long ride or like shooting pains, sciatica, anything that you could think of that might be helpful?
The only thing I can think of is like people on triathlon specific bikes when you're literally sitting on your pelvis. Like a road bike, obviously you're a little more on your sit bones, but in that triathlon position, like your pelvis is completely rolled. Um,
Hmm.
and I think that's it just adds a whole nother layer. And I think everyone that like owns a triathlon bike, if you're not getting a bike fitting, I think you're like doing it wrong because
Oh,
that's like
100%. Yes.
that's
Yep.
so big with, I mean, I think anyone should get a bike fit, but especially on those triathlon bikes because it's just so much different. And a lot of women get like numb on those bikes.
And guys do too, I hear,
Yeah.
which doesn't sound
Hmm.
like that's good for reproductive reasons. They're numb.
Yeah, so the numbness is definitely because of like where the nerves are in the pelvic floor,
Right.
but also the nerves that go into the pelvic floor come from our lower back, which is like right like on our it's in our on our sacrum, so like not like your tailbone all the way at the bottom, but like right where your lower back and your pelvis meet, right? So sometimes the numbness can actually be like if you're on a long enough ride and you're not competing, just like massaging your lower back in that area just to like wake up the nerves can be really helpful, and or doing that after a ride can be really helpful just to like kind of bring more like blood flow into that area. If you know you're going for a longer ride, doing that before can be really helpful because now you're increasing the blood flow to the nerves, which can help to just like get them to function appropriately without getting like overstimulated. So something to think about. And I think the biggest thing you could say, you feel that numbness, start taking like deeper, big belly breaths without, again, pushing down, right? Into the belly, like really like think about how big can I make my belly, open my belly and my pelvic floor like an umbrella. And that can be really helpful to just like decrease the tension, you know.
Yeah. Yeah.
But obviously getting the appropriate gear is very important as well.
Yeah. Yeah. I think yeah, it's also important, right? Because they're looking at yeah, when you get a fitting, they're looking at the full thing too, right? Your legs and they like look if you have a good fitter, they're looking at your mobility too, right? Because
Yeah.
obviously, like we can't all be in this like super arrow position if you like can't touch your toes.
Yes, definitely,
Yeah.
definitely.
Right. And it
Yeah.
doesn't hurt, to have a good bike seat that's, geared to the female anatomy,
Yeah.
good quality bike shorts with extra padding or whatever is most comfortable. I think that just adds to the comfort level
Yeah.
besides the breathing
Definitely.
and everything else.
Yeah.
Definitely. Yep. The gear is so important. I
Mhm.
totally agree. Definitely.
Good
So when's the next big race?
Well, Jane's probably a lot more organized than I am right now.
Yeah,
Well,
well,
you
you got a
just had
lot
two
going on.
weddings.
Yeah.
There's a mountain bike race the end of this month, kind of on our home course, and then hopefully Western Mass 70.3.
Nice.
It's
That's June.
I'm
June,
doing when
early
are you
June.
doing? Early June? Okay.
Yeah.
That's when the courses that you're doing or different race?
Well, the Ironman Western Mass that Hunter's talking about is what, June,
I think
what,
it's
Hunter?
June
Is that
8th.
June 8th? And my race is June 8th in New Jersey, but I do short distance racing. So,
Very cool.
yeah.
Cool.
What about
I
you?
don't know if is anyone on your team doing the Title IX race in Mass?
Oh, that season opener race? That's always so cold.
I think it's September.
Oh, no, I'm thinking of a
Is that
different
the women's try in Hopkinton? I
Uh-huh.
did I did that last year. I was
one.
there.
Yeah, I think my friend, she just had her second. He's gonna be 8 months, and she's like, I want to train for something. I'm gonna do this. So I think I'm
It's
gonna
a
do it
good
with her.
race. It's a
Yeah.
good
Yeah,
race.
That's fun.
I had
yeah,
fun at it last year. Excuse
yeah.
me.
I was a sprint. I like did the 4 and 800 in college, the 400 meters and the 800 meters. So I consider myself like I'm like mid distance, but I'm
Mm,
like the furthest I run is a half marathon. Like that's like my max. So I'm a big like I like the sprint tries. Those are fun for me.
yeah.
Yeah.
Yeah. I run a bunch of 5Ks, but I do them just more for training than anything.
Yeah,
You
yeah,
know,
cool, cool.
there are plenty of them.
If anyone on your team is coming to Alston, let me know. I'd love to connect.
Yeah. Are you guys do anything for the Boston Marathon?
So my office is actually at the finish line.
Yeah, I think I saw a
Mm.
picture of that. So
So
cool.
we do a marathon finish line watch party every year. It's a lot of
That's
fun.
fun.
We got the best view in the house. If you're ever in Boston and you want to come, you have my email.
Yeah.
But we do a big party. I'm signing another 5 years there. So if you ever happen to be there, even if it's in another 2, 3 years, text
We'll let
me.
you know.
I'd love to meet in person.
Yeah, yeah, that's awesome. Good for you. Yeah, Marathon Monday's so much
Yeah, they're
fun.
they're already they're already getting the city ready for it. Like they just put up the blockades already. I'm like,
Wow.
Yeah.
Yeah,
They
because
painted
it's
the
time.
line. I saw
like
that
the
online.
They paint you wouldn't believe how
Finish.
many people. I was laughing so much because it was just I was watching them spray paint it on, and they didn't even have like a ruler. Like it was literally two guys holding a letter down. It literally looked like when I do stencils with my son, like holding a stencil down. One guy's holding it with his feet, the other guy's spraying it. I'm like, first of all, wow, I'm impressed that they're like perfectly aligned. And second, I'm like, what? Like, I'm just like shocked by this. Like, I'm like, I don't know. It was just like kind of like funny and mind blowing to me, and it
Mhm.
came out amazing. And I'm like, wow, okay, they got it figured out. They've probably been doing it for the last like 20 years. They're like
Yeah.
two
right.
older guys, but
Yeah.
It's so
it
funny.
was
Yeah,
it
you'd
was funny to
expect
watch.
something so much more professional.
More sophisticated. It was literally like one letter at a time. I was like, wow, interesting. Okay,
Yeah. It's not
that
till the
was funny.
21st, right?
Yeah, we got time, but they I do feel like they're like planning very far ahead this year, but
Who
yeah, I
knows?
don't know. We got a while.
Yeah,
Yeah.
I'm going to be at the 10-mile mark. It's my second
Nice.
time watching it in a few years, and that's in Natick.
Yeah.
And it's crowded there too.
Oh, it's crowded the whole way.
I
Yeah,
know.
it's so fun. Have you ever been to Heartbreak? That's a good place to go to too.
No, I mean, I'm going with a few other people. We're all older, and it's like, how much do we want to fight the crowd? So
Yeah. Well, I
Natick,
was gonna say that's actually a good place to park. You could park in the neighborhoods, and if you don't mind walking a little bit.
no, not at all. Yeah.
Um, so it's like, I mean, that's like mile 1920, and it's like
Mm,
you're going straight uphill. So it's like
right.
we used to bike, my husband and I, because we lived out there, we would bike to there and always
Mm,
just be like, what could, like throwing like food at people if they wanted, like,
yeah.
just for fuel, because there's like no like fuel station there either. It's
Yeah.
like, but it is so much fun. I mean, there's a crowd the whole way. I would
Yeah.
feel like I don't know if you ladies know they do a bike the night before.
Yep.
Have you
Yeah.
guys? Yeah.
Heard of
Have you
that.
Doesn't
done
it
it?
start at like midnight or something?
Yeah, it's at midnight. Yeah.
Yeah, I haven't done it.
Yeah.
I've had a couple friends that have.
Yeah.
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 They do that with the Hartford Marathon as well. I think Christine, who was
Mm.
on earlier, I think she's biked that the night before, if I'm not mistaken.
Cool. Yeah,
Yeah.
my husband ran the Hartford Marathon.
Yeah. It's a good
Yeah,
one.
it's a good one. It's a good one. Yeah.
Our
Yeah.
claim to fame.
Awesome. Yeah, very cool. I know.
Thank you so much. This was so good. I can't
Yeah.
wait for
Thanks.
everyone to watch it on YouTube.
Yeah, let me
Um,
know if anyone has questions. Like, I'm always
Yeah.
open
And
to for
I'll
emails. So
I send out a newsletter next week, so I'll put your email in there too.
yeah, perfect. Sounds great.
and
Thanks
Hunter,
for
I think
having me.
that one particular slide with the exercises would be, if we could
Yeah.
pull that out of there, that would be nice to
Yeah.
share
Let me make a
for
note.
maybe people that
I wonder.
don't watch the
Let me see.
Zoom.
I wonder if I have a handout too. Let me look for that if I don't. But yeah, feel free.
But Juliana, I'm going to count. I'm going to do my 1/1000 when I pee now to see how long,
Yeah, I'm
if I'm
curious.
shortchanging myself by going too soon or not. So that's one of my things
Yes,
I'm going to
yes.
do.
It's a so how are actually you guys have like one more minute? I'll just show you
Yeah.
what our
Yeah.
bladder log looks like. Let me pull that up for you. To be honest with you, like I'll do this to check in on myself sometimes if I feel like I'm like, wow, I feel like I just went to the bathroom. I kind of use it as like a pulse check for my patients, but again, like I said, for myself. Um, so can you see the log?
Mm-hmm.
So like I'm not so much like worried about food intake unless you tell me like every time I have my big pasta meal that I feel it with like all my sauces, I'm like going to the bathroom often because that it can be a bladder irritant. But like I'm more worried about your fluids. So like when are you drinking fluid? So it's literally like your 24 hours, right? So
Mm.
it would be, let's say 6 a.m. I'm having my 8-ounce cup of coffee, and then 8 a.m. I'm having my 8 ounces of water, and you kind of log your fluid, and then you're logging when you go to the bathroom. So usually we're looking at urine, but you can also log bowel, especially if you're noticing like maybe I empty my bowels very frequently after I have my morning cup of coffee. So you'd kind of would put like how long you went to the bathroom. So we do it small, medium, large, or seconds. So again, seconds, 1 Mississippi, 2 Mississippi, 3. If there was any leakage, so if you went to the bathroom and then you like maybe stood up to wipe and you noticed leakage, and or you were doing some type of physical activity or even just sitting and standing and you noticed leakage, like when did that happen, and logging that. If there was an urge present to go to the bathroom or if you just kind of went. So one would be like, I feel something, I should probably go. Two means like, I really feel something, I should go. And then three is like, oh my God, am I gonna make it? So that's kind of how we
You're
do
running.
it. And then you're running, you're like, I need to get there ASAP. And then the last one is if there's any, like for you, I would say activity with leakage. And I know you're not maybe leaking when you're bouncing, but you're saying like, oh, okay, at 9 a.m. I had my coffee. At 10 a.m. I had 6 ounces of water. At 11 a.m. now I'm bouncing and maybe never didn't go to the bathroom at all from 9 to 11. It might make sense that you get some input into the pelvic floor. Your bladder's a little full. I have to go to the bathroom. But maybe you did that same situation, but you went and then you went maybe before you got to your grandson's house and then you went and bounced and you're like, well, I just went like not even an hour ago. Why do I have to go again? So that might be something this could be helpful in understanding like what's happening in your body.
Yeah.
So
Yeah.
I could send you this if you're interested in people looking at this. So let me know.
Cool.
Happy
Yeah.
to.
I'd be interested just to, see what my pattern is.
Yeah, exactly. It just helps you understand your body more. So
Yeah.
I'll email that to you, Hunter, so you have it.
Yeah, that'd be great. It's like what I
Yeah,
make my
cool.
therapy clients do. Track your mood.
Yeah, exactly. Yep.
Half
Cool,
of them
cool.
don't listen though. So
I gotta watch that YouTube video. I'm pulling and pull
yeah,
that
it's
up before
super
I leave
cool.
here.
And it's
Okay.
just like, and it's cool knowing she's like one of the best in the world too right now. So
Yeah.
Very cool.
yeah.
Awesome. All right, guys. Thanks again for having
Thank
me
you
and
so
thanks for
much. That
tuning
Thank
was
in.
you.
great. And if
Yeah.
we're in Boston, next time I'm up there, I'm gonna let you know.
Yes, definitely let me know.
All right. Have
Okay.
a
Sounds
great
good.
night.
Thanks for joining. Bye.
Bye.
Thank you.
Thank you.